Knee replacement surgery, or total knee arthroplasty, begins with the patient under general or regional anesthesia, positioned to allow full access to the knee joint. The surgeon makes a precise incision down the front of the knee, carefully exposing the kneecap and joint structures. Damaged cartilage surfaces at the ends of the femur and tibia are meticulously removed using specialized cutting instruments, along with a small portion of the underlying bone to prepare the joint surfaces. These bone ends are then shaped precisely to fit the artificial components, ensuring proper alignment and stability. Metal implants are positioned onto the prepared bone surfaces and secured either with bone cement or by press-fit techniques, depending on the implant design and patient factors. A durable plastic spacer is inserted between the metal components to create a smooth, gliding surface that mimics natural cartilage. If necessary, the surgeon resurfaces the underside of the kneecap with a plastic button to improve joint function. The joint is then tested through a full range of motion to confirm proper movement, alignment, and stability, with adjustments made as needed. Finally, the incision is carefully closed using sutures or staples, and a sterile dressing is applied to protect the surgical site as the healing process begins.